Right now, Richard, we're looking by early next week. The scientific team is going through kind of the final stages of a very robust 45,000 individual study. It covered 3 continents, 8 countries. Some of those countries include South Africa and Brazil. So as we hear about new strains, that presents an opportunity where maybe we'll gain some insights on some of these new strains once the sequencing is done. But we're looking at no later than early next week.
If that's the case, when this is the how long is a piece of string question. When likely first jab in arm?
That's a great question in terms of first jab in arm, and it presumes a lot of ifs. So certainly want to get that emergency use authorization based on some of our peers. That's been a couple weeks in time. We want to make sure too that the government authorities are approving of our manufacturing facilities. I don't anticipate any setbacks, but I'd hate to speculate as to when the first jab in arm might be. We'll rely on Dr. Paul Stoffels to give that information out in a couple days here.
Understood. Once you've got it, and one assumes it'll be sooner rather than later, your vaccine is different. It doesn't require any major refrigeration.
Correct.
And it's single dose.
That's correct.
And assuming it has an efficacy rate, and I don't have any reason to doubt that it'll be in the high numbers like everybody else's, where's your biggest market for this?
Yeah, boy, that's a great question. I think right now, every market is a big market, right? We know that through our decades of research in infectious diseases, one of the best things we can do to stunt the pandemic and even stunt variants is to have people vaccinated. So we have supply agreements with the United States, with the European Union, as well as Gavi, the Global Alliance for Vaccine and Immunizations, for developing parts of the world. So we see this as a global opportunity, a global need, quite frankly, in terms of addressing what is, on the forefront of everybody's mind across society.
I was somewhat naive at the very beginning when I heard of all these other vaccines being made, and I heard Pfizer and Moderna at the front, and I thought to myself, why are they bothering? I mean, if there's a front runner and a second and a third, why is everybody else getting into this game?
Yeah, listen, I think at the time, if you think about, I will classify this as really a medical miracle to think that this time last year, Richard, we really didn't even know the strain or the sequencing of the virus itself. And today here we're talking on the cusp of having 2 vaccines already approved. Congratulations to Pfizer and Moderna, and then potentially our vaccine here in a couple days with some data pending approval. I think at the time, nobody knew what was going to work. We had a great deal of confidence, given our work in Ebola, in HIV, with this particular platform, that it would be safe and tolerable. We had studied over 100,000 individuals in clinical trials leading into this vaccine candidate. What we were waiting for, and what we'll see hopefully in a couple days, is the efficacy. And nobody could really predict that. So I think it was smart to have a number of shots on goal, if you will, by the life sciences industry to address this pandemic. We know that good health is kind of first and foremost in terms of having a good economy.